This is Carmel Angelo, Mendocino County Chief Executive Officer, and we're here today for our Friday time with the media. And today we have Dr. Doohan, our County Health Officer, who will be giving an update. Dr. Doohan?
Yes, hello, Mendocino County. I'm glad to be with you here today. So there are several things I want to speak about today, the first being sheltering in place orders. So regarding where we're at in the state of California is that our governor has an emergency order that has put all of California in what he's calling phase one of a 4-phase pandemic process. And we're just in the early phase one. Phase one is focused on safety and preparedness. The governor, any minute now, I've been waiting all day along with others for the governor to announce that all of California can go into phase two together. Phase two is the lower risk workplaces limited reopening phase. And actually phase two has two parts. There's early phase two and a later part of phase two. And the later part of phase two is allowed once an attestation process occurs, which is complex and will be happening later this month. Then there's phase three. Phase three is when higher risk workplaces open, and phase four is the end of sheltering in place. So what's important to know here, first of all, is that the governor has an executive order that determines when we in Mendocino County can progress into limited reopening. And the good news is, because of indicators from across the state, including in our own county, it is expected that today we will be able to enter into phase two, the first part of phase two. So I have been working with county council for weeks now in preparation for this date. And for those of you who have been following closely along with the different orders that I've written and released, you will know that I promised that by May 11th, I would be having a limited reopening shelter in place to be released. But because of the governor making his decision today, I am going to be releasing a limited reopening shelter in place order by this evening. And we're just waiting for the governor at this point. For those of you who've been following along, you'll know that I put up on the county website a draft sheltering in place order for this limited reopening on Monday. It was discussed with the Board of Supervisors on Tuesday, and I've been receiving public comment through our call-in center and through our Board of Supervisors and through the city managers and various avenues to my sheltering in place order. And I've been taking all of that feedback under careful consideration, working with county council, and you will be seeing my new sheltering in place limited reopening order coming within hours after the governor releases his order, his new executive order, which we do expect today. If all goes as we expect today, my new limited reopening order will take effect as of midnight tonight. Now, if you look online on the county website, which I encourage you all to do, you'll see the draft limited reopening order that I released on Monday. It's a draft. And I said at every opportunity possible that it wouldn't become finalized until the governor released his new executive order. So some of those things in that draft I already know are not going to be able to be allowed because the governor has explicitly stated yesterday that they would not be allowed. One of those things that won't be allowed, unfortunately, is swimming pools to be opened. The governor explicitly said no to swimming pools. Another thing that will not be allowed yet into the early part of phase two is more than curbside pickup for retail. I am in my order going to be allowing curbside pickup for retail, but the governor has said that is all that we can do now until this attestation process occurs, which I'll speak to in a moment. So there would be too much for me to go over regarding my limited reopening shelter in place order in this brief update, but look to the website. We will be posting it there, and there will be more opportunities to talk about the limited reopening orders, certainly later today when I'm being interviewed, as well as next week. But it will be there for all to read online, and it is a clear document that does state in as clear language as possible what is allowed and what is not allowed. There also are FAQs that always accompany the sheltering in place orders that will continue to be generated. And there's another document that I thought was helpful. I did get good feedback about it. And that was this green, yellow, red grid. And I want to clarify what the green, yellow, red grid means. And that was also on our website. The green is what we're going to allow, what we're allowed to include in the limited reopening. For example, curbside pickup for all retail will be allowed. The yellow is what the governor is saying we cannot open until later in phase 2 after we go through the attestation process. So that will be coming, I would expect, around June 1st, if the governor allows those things in the yellow box. In the red box will be those activities that the governor has said cannot be allowed till phase 3. And phase 3 is when we have higher risk workplaces allowed to be open. We don't know when phase 3 will occur. That depends on a lot of things. That depends on whether our limited reopening causes there to be outbreaks across Mendocino County. And if that happened, we might have to go backwards into phase 1. And the governor has made this very clear. So we don't know when phase 3 would occur, but if we continue to do well in our county, I would expect phase 3 to be occurring towards the end of the summer. Now, phase 4, that's the end of sheltering in place. And we don't know when that will occur, but we don't think that that's going to occur this summer based on what we're finding from science and evidence and also from what the governor is signaling. So regarding this, this attestation process that would allow us to move from early phase 2 into later phase 2 of limited reopening, this depends on a number of factors, which we've been working on very hard in Mendocino County now for over 100 days. This includes elements like surge capacity for our hospitals. It includes having personal protective equipment on stockpile so that if we have outbreaks, we can respond safely with our healthcare providers. This includes having a workforce ready to do case investigation and contact tracing, which is what we've been doing already with every single case. Every single one of the 12 cases we've had in Mendocino County, we have done case investigation and contact tracing. This also includes having a workforce ready to respond, and we have that as well. It also includes having alternate care sites where we can have isolation and quarantine housing. So we have done everything we can to prepare in advance for the ability to move forward with this attestation process. We also have done everything we can for testing regarding, which is another requirement. We've done surveillance testing. We've done focus testing on people who have symptoms. We've facilitated testing for our healthcare partners. And we've done over 1,500 tests in Mendocino County, together with our clinics, our hospitals, our public health department facilitating the testing. And we are doing a big focus testing right now, in fact, right now as I'm speaking, up in Covelo to respond to the outbreak there, which in all indications at this time is being contained. The one thing we cannot do to reach this attestation milestone and move farther along into phase 2 is that we do not have the PCR testing, the diagnostic testing capacity in our county. We do have some small capacity at the hospitals and some of the clinics to do some small volume testing, but we need to do 135 tests a day. That's not just the sample collection where we collect the swab sample and put it in viral transport medium in a tube. This is the actual PCR test. And I can tell you that CEO Carmel Angelo, who's our incident commander, and I have been working tirelessly to get more PCR testing capacity for our county, but we do not have it at this time. And therefore, at this time, this is the one barrier that I don't see how we're going to move forward with this attestation process as of today. But I do feel confident that we will get through this barrier, and I am hopeful that by the end of this month, by June 1st, we'll see ourselves be able to enter into more of those yellow box areas of limited reopening, such as limiting retail fully, not just curbside pickup, but opening up the retail store so we can walk in and safely, with social distancing and facial coverings, shop in our stores. The other thing I want to ask Mendocino County you all to do is familiarize yourself with the orders that are on the Mendocino County website. These orders that I've written with County Council working with me include facial covering order for the public. It includes a masking order, which is going up today actually, for medical environments, and when in medical environments, medical masks should be worn. It also includes our sheltering in place orders, the newest one coming up today. And the sheltering in place orders includes the social distancing and hygiene protocols for businesses. There's also isolation and quarantine blanket orders, which say for those people that have been tested positive for COVID-19 or their contacts, what they must do to keep the rest of us safe. So I'm going to ask you, Mendocino County, to please look and read those orders yourselves, because one of the things that I've found when people give feedback about what they're frustrated about in our county or what they think isn't going well, often those things are already addressed in the orders. For example, facial coverings. Facial coverings are not only meant for people when they're out in public to be worn in stores, they're also meant for people when they're out in public for them to wear them when they might come into contact with other people. And the facial covering protects the other person from us. So if I wear a facial covering, it's protecting my neighbor from getting COVID-19 from me if I might be in the asymptomatic period. The facial covering for the public order also outlines what people who are working in businesses, those workers must be doing regarding facial coverings. Now, these are non-medical environments that I'm talking about. So what I'm asking you to do, Mendocino County, is read these orders yourselves, because more and more, as we progress through this pandemic, and remember, as of this moment, we're still in the beginning of the 4-phase pandemic process. We're still in phase 1. As we progress through this process, more and more, we have to, as individuals, be responsible for our own actions and do those old-fashioned things that we're doing to stop the spread and flatten the curve, like wearing facial coverings in public, staying 6 feet away, washing our hands, all of these things, which many of you are doing so well, but we need to do them even more as we have limited reopening. Because as we go out more with limited reopening, these types of hygiene practices and social distancing practices are going to be what keep us safe. So as well with sheltering in place, just because we're doing limited reopening does not mean sheltering in place is going away. So as I mentioned, it's not till stage 4 that sheltering in place goes away. We must stay home when we're sick. This is continuing to be a requirement of sheltering in place. We also must have people who are elder and people who have multiple medical problems or are frail stay home to the extent possible. So we should continue to help out our neighbors who might not be wise for them to leave home by helping them, for example, help them with their shopping, help them if there's something they need so that they are better able to stay home. I also want to end up by 2 things more. One is to say that I'm delighted that Dr. Iser, who is a highly respected healthcare, public health professional, is coming to join us in Mendocino County. During a pandemic, we need highly skilled public health professionals to lead us, and Dr. Iser is one such person. And I want to thank you, Dr. Iser, for joining us. And also, I'm delighted to report that Dr. Iser is planning to move to Mendocino County to lead public health in person from Mendocino County. And finally, I want to end up by talking about testing and in particular, the Covelo outbreak. So we have done over 1,500 tests in Mendocino County, as I said. These include surveillance testing. It includes targeted testing for people who've been sick. And it also includes testing around potential outbreak. So of our 12 individuals who tested positive for COVID-19 in our county, the very first one, as many of you have figured out, was in Gualala. Now, I have kept the locations of cases private because I rely on those individuals being willing to share important information with public health so we can do our case investigation contact tracing. This is why we have reported cases by region and not by their actual town, because we have small towns. But it's enough time has passed to say that that first case was in Gualala. And we know that that did not lead to an outbreak because we have done surveillance testing now in Gualala and it did not really reveal any positive tests. So we, with every case that we've had in Mendocino County, have not had an uncontained outbreak, and every single one of those cases was related to travel. The Wallala case was related to travel. The second, third, fourth cases were related to travel. The fifth case was an early release from prison that was related to travel outside our county. The 7 cases that bring us up to 12 from Covelo all were initiated, as far as we can tell from our case investigation and contact tracing, from travel by a family member from the Bay Area to Covelo. And those 7 cases, I have very good news. They've recovered, and all of them have recovered as of today. The final one is recovering tomorrow and are able to be released from isolation. Every single one of our cases recovered at home and did very well and completed their isolation with absolute cooperation, and their contacts were quarantined. And for this reason, because we had such good case investigation, contact tracing, and such good cooperation with isolation and quarantine, we haven't seen further outbreaks. So we are focusing with great intensity right now on Covelo to make sure that we're not missing any other cases that there might be in the community. For that reason, we have had 3 days of intensive drive-through testing led by our public health department up in Covelo last Monday and Wednesday, and then again this Friday, and then we will be resuming again next week with the drive-through testing. This is done in close collaboration and leadership by the Round Valley tribal leaders who have invited us to partner with them to do this drive-through testing. And so I'm very, very appreciative of President Russ and the leadership of the tribal clinic in Round Valley. So thank you. It's also been done with the great collaboration of our California Department of Public Health, as well as Cal OES, providing support from afar, but also with CRIB, the California Rural Indian Health Board, and their EPI division has been absolutely invaluable in helping us do the case investigation and contact tracing. So I do not believe that the Covelo outbreak is fully resolved at this time. We still have a lot of work to do to just make sure we're closely following the community, offering testing, and continuing to closely follow along. The testing that we're doing for an outbreak, we're facilitating through the state public health lab in Richmond, California. So we're grateful for the state lab in Richmond to receive the samples that we're collecting from Covelo so we can get rapid turnaround on those. So thank you, Mendocino County, for doing such a great job. We've worked together so hard to get to this point where we are today, where we only have 12 cases, that we have had no deaths, we've had no hospitalizations. Everybody is isolated in quarantine who's needed to. And we're now entering Mother's Day weekend with the opportunity to have limited reopening and to open up some of our recreational areas, to open up some activities for children, and to open up our retail for curbside pickup. So thank you. And that would be all for my report today. Thank you very much.
Thank you, Dr. Doohan. Again, this is Carmel Angelo, Mendocino County CEO. There's a couple things that I would like to point out before we move to Sarah Duquette and our press partners. First thing is that the Mendocino County offices do remain closed, and we're looking at our offices closed through June 1st. However, some services are reopening, and so if you are requiring a service, I would ask that you call that office first and see if, one, they've reopened or if they're taking appointments. Additionally, there is a new program that we talked about last week that I would like to emphasize again today, and that is called Great Plates. And that program is for people that are 65 and older, or people that are 60 to 64 and have a compromised health system. And so at this point, it is to provide 3 meals a day and to assist you if for some reason you are staying at home due to your health concerns regarding C19. There are 2 numbers you could call to reach the Adult and Aging Services for this program, Great Plates. And those numbers are 707-463-7900 or 1-877-327-1799. So let me clarify. Those numbers are to call Mendocino County Adult and Aging Services. 1, if you are a senior, 65 plus, or if you are between the ages of 60 and 64 and have compromised health. And you can call and ask if you qualify for the program. Additionally, if you are a restaurant and you are willing to participate in the program, that would require that you would provide 3 meals a day for one of our participants. And there is a stipend that you would receive for this program. So we see this program as one, an economic stimulus, particularly for those restaurants that are really struggling now because of C-19, and two, for people that are home, that will remain home, and that need assistance with nutritious meals. Additionally, I would like to remind everyone, we do have a call center that's still open, and you can call that number, the call center, if you want information or you want to give some information, or you have a concern that you would like to share regarding C-19. This could be enforcement, this could be a health reason, anything. Again, it's not 911, it's an information line. And that number is 707-234-6052. And we also have a Mendocino County warm line, and this is a non-crisis support line. It's manned by Mendocino County behavioral health staff. That number is 707-472-2311. And both of these numbers are Monday through Friday, 8 to 5. And lastly, I would like to say that we have put out a call to action for people in Mendocino County. You heard Dr. Doohan talk about revising the shelter-in-place order and working on reopening Mendocino County. The state has some very strict guidelines, in fact, not guidelines, but restrictions as far as what we need to meet to reopen Mendocino County. One of those restrictions has to do with testing and how many tests we need to do in a week in order to be able to reopen businesses. Mendocino County has the supplies, the supplies to collect specimens. We have our staff that are trained on how to collect specimens for C-19. What we don't have is the ability to analyze those specimens. Some years ago, we closed our public health lab. We closed that public health lab because it was costing money and it wasn't providing a service at that point in time. And we didn't have the staff in Mendocino County for the lab, because you have to have very specific certifications to work in a public health lab. And we had people from Sonoma County Lab that would travel here to man our lab. So we closed it. Since that time, we have contracted for lab services. But right now with C-19, everybody is busy with lab specimens. So we do not have the capacity to meet our numbers that are required in order to reopen, further reopening. So we are asking for the public's help. I have an email that I'd like to give you, and this is testing.taskforce@state.ca.gov. Again, that email is testing.taskforce@state.ca.gov. Dr. Charity Dean is co-chair of the Testing Task Force. She has been working with us. I think it would benefit the state if they would hear more from the people in Mendocino County about how important it is that we stay safe, stay healthy, and begin to reopen our economy. So thank you for this call to action. If you have any questions, you certainly could call us at Mendocino County. Anyway, at this point in time, I think I would like to turn it over to Sarah Duquette, who will work with the press, and Dr. Doohan. Thank you.
This is Sarah Duquette, and we're going to take live questions from the media on this Friday update. First up is Sarah Wright from KZYX. Sarah, you're live.
Hi, thanks so much for taking my question. I'm wondering about how the county government is working to support local businesses, especially a recent recommendation to create a no-interest rate loan fund for economic resiliency.
This is Dr. Doohan. I think I'd like to ask Carmel Angelo to answer that question, perhaps.
Yeah.
Thank you. Again, this is Carmel Angelo. We have an ad hoc within our Board of Supervisors. And actually, we have an interest of all 5 supervisors to work with the business community to assist with the economic downturn. And additionally, we have a contract with West Company, and they are our economic arm along with EDFC, and they are tasked with working with the business community, determining what the needs are out there, and working to inform the county as to how we can better support the economy within the county and the businesses.
And I think my next question is also for the CEO. If the Board of Supervisors chooses not to hire a replacement for Dr. Doohan as the public health officer, what are the options of the county other than giving up all local control over our reopening process?
Well, thank you for that question. It's not an option in reality. We must have a county health officer by law, and particularly in the time of a pandemic, to not have a county health officer would mean that the state would come in and they would direct public health within our county. If you look at what's happened so far, we know that the state under Governor Newsom has done the best job they can in trying to keep the state healthy through this period of time. I would be very concerned about not having a health officer right now and having the state of California basically direct Mendocino County more so than they currently are directing Mendocino County. Our health officer is an exemplary health officer who has worked with us to keep us safe and to try to meet the needs within the community. It's been difficult because we do have restrictions that are put on us by the state. So without having a local health officer, we give up local control. That's the bottom line. And the state will come in and they will tell Mendocino County what to do, more so than they're doing right now.
And is the county looking into sharing a public health officer? I know that Yuba and Sutter counties have made some controversial decisions lately, but they do share a public health officer, Dr. Huang Lu. So I'm wondering if that's an option other than the one that you just described.
So, Sarah, I'm sure there are many options that our Board of Supervisors has. And if the board directed us to look at sharing a health officer, that's what we would do. We have looked at sharing a health officer in the past with Sonoma County, with Lake County. You know, it isn't a new idea. However, it doesn't always work, particularly in a pandemic. I really can't imagine how the Lake County health officer, our health officer in Mendocino, Sonoma County health officer would be able to handle more than one county. I will tell you with Yuba and Sutter that I am familiar with. Yuba and Sutter shares a lot of services because they're close proximity and just because of the nature of their governments. And I know in this case that Yuba Sutter did move forward ahead of the governor and ahead of the state health officer and opened up to businesses much more so than what is permitted in phase 1 and even phase 2. I can tell you that it has not been easy and that they have heard from the state, and it's very challenging for them to continue at the manner they are. So I don't know that this is the time to share a health officer, and I don't know that any of the surrounding counties would be willing to share a health officer or that it is the best model right now. I can tell you with other models that we have where we share services with other counties, when you have an emergency or an event like this, what happens is that particular entity or service or people, they have competing priorities. And it doesn't always work. It is not a model that is effective at times, and particularly during a pandemic. Thank you.
Thank you so much.
Thank you, Sarah. Next up will be KMUD. And KMUD, you should be live on the air. Let me unmute you. And you're live on the air.
Thank you. I think there's a little lag between the YouTube feed and the Zoom. My name is Matt Lefevre. I'm with Caveman News. Dr. Doohan, CEO Angelo, thank you for taking the time to take my questions today. I wanted to start off with my first question is aimed at the testing capacity within Mendocino County currently. As we're easing shelter in place, we're unable to maximize loosening under the governor's new order due to insufficient testing capabilities. I just saw a Facebook post written by you, CEO Angelo, where you described Mendocino County as a lab testing desert. And I'm curious, what is being done like concretely to increase that testing capacity? What resources are being sought? What outside organizations are we trying to collaborate with to increase that?
Dr. Doohan, would you like to take this first, or would you like me to?
CEO Carmel, Angelo, why don't you take it first and I'll follow.
Thank you. So to answer your question, yes, I did not coin the phrase of a testing desert. That is a term that Governor Newsom has talked about in his press conferences. We didn't coin the phrase, but that's what we are. And so as far as, let me just try to do this as succinctly as I can. As far as resources for labs, Dr. Doohan could really speak to this better than I can, but we have an existing contract with a county close to us, actually with Sonoma County, and given the numbers that they need to make so that they can attest to being able to reopen, they do not have the capacity to do their analyzing of specimens and to do ours. So there is a lab in Humboldt County, which is actually further than Sonoma County, so that may not be practical. And there are labs in the Bay Area, and I will leave that one for Dr. Doohan. But as far as what we have done, as far as public health labs, state labs, we are doing everything we can to secure an agreement with one of these labs that they will do our testing, which is not only outbreak testing, but surveillance testing. Now, that's local, along with some of our local hospitals and clinics. But you must have capacity. And at this point in time, we have not secured any entity, whether it's inside this county or outside of this county, that agrees that they, one, have the capacity, and two, that they will do not only outbreak testing, but surveillance testing. So that brings me up to our work with the state. And I want to say, and I always say this, and I'm not paying lip service, I really mean this. Senator McGuire, Assemblymember Wood, and Congressman Huffman are right there with us. They are in the trenches with us. I would say that I speak with either them or a representative from their office at least once a day. And the issue is testing. They're very much aware. We have supplies. We have staff trained. We don't have a lab to analyze our specimens. So we have been on the phone with the state, specifically the California Department of Public Health, and also Dr. Charity Dean, who is the co-chair of the testing task force. And we have literally been begging for resources, literally begging. And I really believe that this is the plight of small rural counties, that many times people don't understand what it's like to live in a rural community and the lack of resources that you have in a rural community. So we continue to lobby the state to give us a resource here. And at this point, we would take one, either a contract with a state lab, even if we have to travel 2 hours there and back to deliver specimens, but a state lab that would agree that they would do our testing for us. The optimal situation would be to have a mobile testing unit in Mendocino County that could not only provide the specimen collection equipment, provide the staff to do it, but also then send out those specimens to another lab. So, those are our options right now that we see as the best options and what we have been working on. And again, I'll say we have had great support from McGuire, Wood, and Huffman, but none of us have been able to break that barrier with California Department of Public Health. Dr. Doohan?
Yes, thank you. I agree with everything that Carmel Angelo just said. I would add that up until this point, we have been able to test 15 to over 1,500 tests, and that has been a great achievement. That has been achieved with our clinics, and the clinics continue to be able to do testing for people that come into the clinic or call into the clinic and are having symptoms, and they will do drive-through testing. They'll be able to coordinate testing for the patients that come for care at the clinic. So the clinics have been on the front lines of this from the beginning. And what the clinics do is when they collect that sample, it gets sent off to Quest, which is a lab that's in San Juan Capistrano. And it's just like any test you might get in clinic. It often gets sent away to somewhere else to be processed. The hospitals have their own now. I mean, this has been a rapidly evolving situation from the beginning. The hospitals now have their own PCR machines. Ukiah Valley Hospital, last I checked, their capacity is to do 60 tests a week. And Howard Hospital in Willits, their capacity with their own PCR machine is to do 70 tests a week. And then in Covelo, the way we were able to so rapidly respond to this outbreak is because the Round Valley Indian Health Center has their own Abbott machine that can do a limited number of tests right there in the clinic for people who present, who are sick. And they did that. And that's how we found out about that outbreak so very early on. So I don't want to give the impression that we don't have any testing capacity in our county. And I know that Carmel wasn't trying to imply that either. We do have testing capacity, but not to the level that we need as we do limited reopening. So if we were to shelter in place indefinitely for a year, we wouldn't need more testing probably. We could do all right with where we're at, but we are limited reopening. And when we do that, we know that our protection is not only the facial coverings and not only the social distancing, but the increased testing. The increased testing has to come alongside the limited reopening. And that's why we're raising this so loudly right now, because we have done everything, every single thing to prepare for limited reopening, except the one thing we just can't do in our county, which is have a PCR machine. So we do have some small ones, but we can't have a big enough one to do 135 tests a day. That's the metric we have to meet. And that is a combination of both surveillance testing, as Carmel said, as well as targeted testing. And to give you an example of one of the partnerships we have that's so important, where we facilitate the testing, and that's the jail. When we have an inmate or a worker from the jail, we're called at public health. The jail nurses collect the sample and we facilitate that testing to get it done very quickly. Currently, that's done in the Sonoma County lab, which is a shared lab that we use in Mendocino County. And the amount of testing that they can do for us is going to shrink down to 18 tests a day when we need 135. So we will continue to be very grateful for those 18 tests a day from the Sonoma County lab, as well as the outbreak testing that the Richmond State Lab has said that they will do for us, but it's not enough to meet the 135 metric we need a day. Thank you. That's it.
Thank you for addressing that question. And, you know, I think this question is both for CEO Angelo and Dr. Doohan. You know, Governor Newsom yesterday announced a dramatic $53 billion deficit in the wake of pandemic protocols. And there's been a rise in shelter in place protesting happening across the state. And ultimately, I'm just kind of curious, you know, of course, you're furthering the orders of the state as county officials, but just you as county officials representing Mendocino County, looking out for our interests, how do you weigh the protocols necessary to halt the pandemic against these effects that these protocols have had on our community and our overall economy? Well, thank you.
Well, Dr. Doohan, I think I can answer that. This is why we're entering into limited reopening at this time. If I was just looking at a public health perspective, purely public health, I might want to wait a bit longer. but there are pressures on us that go beyond the war we're fighting against this virus that have to do with our economy and also the well-being of our people. For example, children need to be able to get outside and play, and we can't just keep the children indoors. So we have to weigh in public health, we have to weigh the pure public health issues like the war against the virus with the well-being of our entire community. And the way that I justify this to myself as a public health professional is to say that we have really great old-fashioned weapons that we can use in Mendocino County to protect ourselves against this virus, this evil virus, I'll call it that. And that is that we can do social distancing, we can wear facial coverings, and even when we open up our shops, if we all take personal responsibility and stay home when we're sick, cover our coughs, wash our hands, we can do a very effective job of slowing the spread and flattening the curve, even with limited reopening. So it is very, very difficult because our economy has to have us reopen. It might be sooner that the public health professionals would like, but we can do it. I believe we can do it in Mendocino County because we have rural strengths, and we also have done a great job of following along with the orders. And again, I really do encourage all of you to read the orders online and see what the facial covering order says about the public, see what the sheltering in place order says, and as much as we can follow those orders, they give us great protection.
This is Carmel. I think Dr. Doohan really covered it. You know, the significant challenge of keeping people healthy and watching the economy tank. I think that the $54 billion that the state is talking about as far as this year and next year, that will hit us. That will hit us in our services. That's a reduction in realignment, a reduction in Prop 172 dollars. That is our tax revenue that pays for the very services that the people right now that are impacted by this economy, those are the services they need. So we're extremely challenged, just as every other county is in the state. And as we move forward, our board is very concerned about this, and we will be working more and more trying to stretch this dollar so we could provide the services to the very people out there that have been impacted by this pandemic. Thank you.
Thank you. Thank you, K-Mud. We're going to move to Willits Weekly. And Micah. And Mike Adair, we should have you live. All right, well, we will see if we can, here we go. And you are live on the air, Mike.
Okay.
And Mike Adair, we should have you live.
Yeah. I want to apologize to you because I missed about the first.
We will see if we can. Yeah. Mike, you're muted. Make sure you mute your live feed, please. You're muted. All right, we're going to come back to Mike Adair once we get the technical issues figured out, and we're going to go to Adrian Bowman with the Mendo Voice. Adrian, we have you on the line.
Hey, sorry, did Mike get cut off?
We're having some technical difficulties, so we're going to try to fix that and bring it back.
Okay.
So you're live on the air.
All right, great. Thanks, Sarah. Thank you, Dr. Doohan, and CEO Angelo for holding the press conference. My first question is for Dr. Doohan. I'm wondering if you can give, I know you don't actually have a crystal ball, but within your best scientific expertise, if you can give us an idea of any potential for a surge, both locally and statewide. You've mentioned before, and other public health officials have mentioned before, that there is a strong likelihood that when we do the reopening, we will see a surge in cases.
Well, I think it's absolutely a threat, and I think this weekend is going to be a test for Mendocino County. When you look at my limited reopening shelter-in-place order that I'm hoping the governor is going to allow me to release today, and that will come into effect at midnight tonight, there's the opportunity for people to go out and start recreating. Please read the sheltering-in-place order carefully. There are guidelines about social distancing. It's not asking children to distance from one another or wear facial coverings. I think that's too hard for little children to do. But if we all are very conscientious about how we come out and recreate, then it won't lead to a surge. But if everybody just, crowds together and doesn't wear facial coverings, then it could. So I really think the answer to your question, Adrian, depends on what the people of Mendocino County do in this next phase. And I've always known that when we got to limited reopening, it would be on the good people of Mendocino County to determine our collective fate by how much we continue to follow these old-fashioned practices, such as social distancing. The other piece of it is we really do need to keep the limited reopening that we're doing to be a Mendocino County, I guess you would say, activity. As much as possible, we need to keep our activities in county. And as I did say, the 12 cases that we've had, every single one was either travel outside the county or a close contact of someone who traveled outside the county. So for those of you who might be traveling outside the county for work, we know that Santa Rosa has widespread community transmission at this point. When you come back, you need to be very careful when you come back into our county about who you might be exposing. And when you go out of county, you need to be very careful about your activities outside of county. So I don't know, Adrian, but it really depends on each of us and how we behave in the coming months to see whether we would have a surge in cases. Thank you.
Thanks very much. And so what I'm hearing from you is that it's kind of, we're moving from a situation where the shelter in place is doing the work to where it's going to be up to us individually to do a lot more of those preparations and precautions.
Yes, with the orders that I've written to strengthen everybody's resolve. So the orders are there to be a strength for you, and that's why I'm asking people to read them online, because they provide you with guidance and strength moving forward.
This next question is for both of you, and I want to give you an opportunity maybe to explain to the public a little bit more thoroughly what it means to procure one of these machines. I think a lot of people might have the impression that it's kind of like, maybe it's not as easy as buying a car, but it might be like buying a large piece of equipment. You go down to the store and you pick one up. But that's not the case, right? One of these PCR machines.
I can respond to that. I don't think we have a hope of procuring a PCR machine that would process 135 tests a day for us. We need a partnership. We need resources from outside our county to help us. The OptumServe that CEO Carmel Angelo was talking about is actually a sample collection system, essentially. It comes with staffing support. It comes with the personal protective equipment for that staffing. And it is a mechanism for then shipping large numbers of samples to a lab, actually to Quest Lab, on a regular basis. So it also comes with certain logistical support. So even this OptumServe that I've been asking for is not an actual PCR machine. And so I don't think we will get a PCR machine for that capacity. We need a partnership, such as something like an OptumServe, which facilitates sending our samples in bulk to a PCR machine located outside of the county.
Mm-hmm. I also wanted to ask about protections for frontline workers. And in this next phase, a lot more people are going to be going back to work. I know that your order addresses best practices, but I'm wondering what situation workers might find themselves in when their bosses aren't allowing them maybe to do best practices. We have seen reports from across the country of bosses, for instance, telling restaurant and retail workers that they aren't allowed to wear a mask. So what avenues will workers have if they're put in that kind of position?
Yeah, thank you. So again, the orders that I've written, there's two separate ones that relate to that. Well, actually, all the orders relate to it, but in particular, the facial covering for the public order also includes facial coverings for people working in non-medical settings. So actually, that order, which again is online, says when employers must be supplying or making sure that their workers have facial coverings. Furthermore, in the executive order of the governor that we're expecting to be released today, as we enter into phase 2, and as we're allowed to do limited reopening, for example, of curbside pickup from retail, there is a process that is in my new sheltering in place order, but is also up online for the governor, where each business must do a process which has 5 steps in it, where they perform a risk assessment, they train their employees, they implement control measures and screening, they have disinfection protocols and physical distancing guidelines, and they have to follow industry-specific guidances, which are on the California website. So there is direction coming from the state of California that is then embedded in my sheltering in place order and my facial covering for the public order. So the answer, Adrian, would be that if somebody a business owner wasn't following these requirements, there's a couple things that could be done. First of all, people could not shop at that store because it would be pretty obvious, maybe, that the clerks weren't wearing masks or facial coverings. But the other thing is that you could report it to the state of California, or you could report it to our call center to our for a public health department or our COVID-19 call center. So it is a requirement that these types of safety measures are in businesses. The other side of the answer to that question is the order that is coming into play today, which was a guidance up until today that I wrote for medical environments, and that it has to do with medical masking for medical congregate settings such as hospitals and clinics. That order is also up online today. So the orders provide a framework for making sure that we keep people safe when they go out into public. Thank you.
Thank you. Thank you for that. I'm sorry, was that it?
Did you have something else to add?
No, go ahead. Sorry, I was confused about the Zoom connection for a second.
Thank you, Adrian. Next up, we're going to be going to El Punta. And we have Jackie live on the air, and then we also have George for translation. Jackie, you're live.
Thank you so much, Sarah. Thank you for including Periódico El Punto, Spanish language newspaper, to provide information in Spanish. Mi primera pregunta es, quisiera que se pudieran resaltar los principales aspectos de esta modificación a la orden de quedarse en casa. Sé que ya se explicó en inglés, pero me gustaría que se repitiera en español de una forma un poco breve, porque a veces cuando escuchamos la palabra relaxing, hay un poco de confusión en español en donde se puede confundir a la gente y pensar que se está regresando a la normalidad e incluso pensar que el distanciamiento físico ya no es necesario.
Okay. This is a question for Dr. Doohan. I would like that you highlight the main changes in this new order and when it enters in effect. And I know that it was explained in English, but it can be a little confusing because the word relaxing in Spanish means a different thing. That could imply that we are going back to normal. All the social distances, wearing a mask, could be no longer in place.
Thank you. I want to start out, George, by saying how much we care about our Spanish-speaking community and how important it is that we make sure that we're sharing information to our entire community so that everybody can understand the meaning of the orders. So, if you could start out, George, by just saying how much I appreciate El Punto for coming and representing the Latino community.
Ok, bueno, la doctora nuevamente resalta la importancia que el periódico Al Punto en este momento está jugando para poder estar en conexión con la comunidad hispana y tratar de que todos nosotros podamos tener la misma información, la misma calidad de información, que, así como todo el resto de ciudadanos que vivimos aquí en Mendocino, en el condado de Mendocino.
And to say that we always put translations of the orders up online, and that it does take a little bit of time to do those translations, but they will be up, you know, certainly by early next week, and that we have all of our orders up with Spanish language translation on our website at this time.
Okay, Dr. Doohan, I was listening to you all the time. May I allow to point out certain all your schedule? So I mean, do you imply that by Monday you are going to have a draft? By Tuesday, the supervisors, they are going to approve it, and by Wednesday they are going to be for public comment. May I do that?
Sure, but that already happened, yeah, George. So it was last
Yes.
Monday that happened. Yes, please.
Okay. Bueno, la idea es que todos nosotros podamos contar con la misma información. Lo que sucede es que esta nueva ordenanza todavía no está lista. La doctora está trabajando en esta nueva ordenanza. Ella la va a tener lista todavía para el día lunes, pero esta ordenanza tiene que ser aprobada por el Board of Supervisors de acá del condado de Mendocino. Ellos se van a reunir el día martes, probablemente lo van a aprobar ese día, y el día miércoles va a pasar para que la gente pueda comentar sobre esta nueva ordenanza y ya tenerla finalizada para el jueves o viernes. Y de seguro que ya para esa fecha vamos a tenerla también traducida en inglés y en la página web, perdón, en español, y para que toda la comunidad pueda ir a la página web del condado y poder revisarla y lo más importante, familiarizarse con lo que dice allí, para que todos nosotros podamos estar en la misma página acá en la comunidad de Mendocino.
Perdón, la fecha para terminar el shelter in place de esta última orden era del 10 de mayo. ¿Hay una fecha tentativa?
Okay, Doctor, the previous order, it was said that this shelter in place is going to finish in May 10th. Now, is it going to be any change with the previous order?
Yes, there are many changes, and the new order is coming out. It should be effective at midnight tonight, and it has some freedoms, but it's still very strict. The freedoms, I would say, for this weekend that are most significant have to do with the ability to have recreation, to be able to, for a family, for example, one family to go to the park together, but playgrounds will still be closed. So there's many details in the order about opening up for recreation, still with social distancing, and it should be within our county.
Okay. Dr. Doohan, may I also explain a little bit the different phases that you spoke of earlier?
Yes, please.
Okay. Bueno, la nueva ordenanza va a entrar en efecto esta noche. Okay, o sea, ya para mañana vamos a poder todos nosotros entrar a una nueva fase. En el estado de California, el gobernador ha señalado que todos nosotros vamos a tener 3 fases. La primera fase es la cual nosotros estamos en este momento. Mañana o esta noche vamos a entrar con la fase 2. La fase 2 tiene 2 subfases. Tiene la fase temprana y la fase tardía. En la fase temprana, que vamos a empezar mañana, van a haber algunas actividades que se van a poder permitir. Por ejemplo, vamos a poder hacer se van a abrir algunas áreas de recreación, los parques, la familia van a poder pasear en los parques, pero siempre manteniendo la distancia con otras familias o con otras personas, usando el protector facial, y tercero, manteniendo la distancia de 6 pies con respecto a otras personas. Esa es la fase temprana de la fase 2. La fase tardía probablemente se vaya a dar a fines de este mes o el primer día de junio, en la cual van a haber más actividades comerciales disponibles. Todas estas precisiones van a estar señaladas en esta ordenanza que va a ser publicada la próxima semana. Y finalmente tenemos la fase 3. En esta fase 3, todas las actividades que implican alto riesgo de adquirir el virus o de contagiarse van a ser permitidas. Pero de acuerdo a lo que la doctora opina, la fase 3 probablemente se dé hacia fines del verano. O sea, todavía vamos a estar en la fase 2 por un buen tiempo en estos meses. Yo creo que ese es el resumen.
Okay. Yeah, and I want to say that I understand Spanish, and George says this perfectly represented what I would say. And I know we're coming to the end of this time. What I want to recommend is that we have a session with George, and we could have it with El Punto, to really go over these orders so that we make sure that our Spanish-speaking community can understand what they say. So Sarah, I would like to ask if we could set that up for early next week, just specifically more time, that we can go through this with more time. But they will be posted in Spanish online, and the English version is going to be going up within hours, I'm presuming. So please, let's make more time for this. It's very important. But I'm wondering if we're running out of time for our session.
Okay,
thank you so much.
Okay, para informarle a la comunidad, la doctora Doohan, ella estima que porque hay mucha información en este momento que le tenemos que dar a la comunidad hispana en español, ella va a separar un tiempo especial para nosotros la próxima semana, una vez que tenga todo listo, solamente entre Al Punto, ella, y para que toda la comunidad sepa exactamente qué es lo que tenemos que hacer y cómo debemos prepararnos en las diferentes fases.
Okay. La siguiente pregunta es, ¿puede el condado tener órdenes diferentes a las que propone el gobernador del estado de California?
Okay, Doctor, is there any chance that a county could have a different orders than the California state governor has?
Only more strict. They can only be stricter, not less strict.
Okay, bueno, sí es posible, pero siempre y cuando sean más estrictas, pero no menos de lo que el gobernador establece.
Okay. Y la tercera pregunta es, el gobernador Newsom quiere que por 1,000 residentes se haga un promedio de pruebas de 1,5 personas por día. ¿Esta expectativa es algo que puede cumplir el condado?
Okay, Newsom governor wants the California could test 1.5 person per 1,000 of residents. Is this rate doable in Mendocino County?
Well, thank you for the question. This is exactly what we've been really focusing on today. And the answer is not at this time, but we are fighting very strongly to make this possible for Mendocino County.
Okay. Again, Doctor, I was following all the interview. Maybe it's not time for today, but maybe in next weekend, I can also share with the Latino community what is happening with the labs, the capacity that we have, also the possibility that in the future we could have a mobile clinic like the Carmel Angelo mentioned. May I do that?
Yeah, what I'm wondering, could it be possible for George and El Punto to continue this interview, continue it after I get off the phone? Because I think we're getting ready to wind this down. But yes, please, George, do that, because I know you have an excellent understanding and you can explain it very, very well.
Okay, thank you. Okay, bueno, La respuesta en resumen es no. Sin embargo, yo creo que es importante que todos nosotros sepamos el objetivo que tiene el condado es de hacer 135 pruebas por día. Ese es el objetivo para poder llegar a esa meta que tiene el gobernador. En este momento nosotros no contamos con un laboratorio en salud pública porque es muy costoso. Entonces nosotros, todas las pruebas que se hacen aquí se envían al condado de Sonoma. Sin embargo, y ellos lógicamente tienen que priorizar sus propias pruebas de su propia localidad y ellos allá tienen mayores casos que nosotros. Entonces, se están buscando alternativas. La gerente general, Carmen Angelo, ella está estableciendo comunicaciones con el Departamento de Salud Pública de California, para que el laboratorio de allá puedan ellos procesar nuestras pruebas y hacerlo más eficiente, a pesar que es un poco más lejos, pero lo tendríamos en menos tiempo. Esa es una posibilidad. La segunda posibilidad es que se establezca una unidad móvil de prueba de laboratorio, que esta unidad móvil pueda irse a diferentes lugares y estas pruebas recolectarse rápidamente, llevarlas al laboratorio central en Sacramento y procesarlas para ser más eficiente y tener el resultado de manera temprana. Pero estos son proyectos que están trabajando, pero no nos estamos quedando con los brazos cruzados. La idea es poder llegar en algún momento a esta meta y pronto.
Okay.
Thank you, Jackie and George. We're gonna quickly go over to Mike Adair one more time to see if we can get him live before we end our update. So, let's see. Mike Adair, if you are live on the air, just please unmute yourself and ask your question. Unmute. You are still muted. All right, Mike Adair, you are muted.
Okay, I am.
There we go. We can hear you. We can hear you.
Can you hear me now?
Yes.
All
Please
right. Well, very good. One question. I want to know if our lack in testing capacity has pushed us into a situation where if we did have testing, we would be in another kind of more open and more relaxed. Are we somewhat restricted? And an ancillary question with that is the draft order that went up online last Monday, is that going to go in effect tonight? Is that happening or is it not happening? Thank you very much.
Okay, thank you for that question. So I can answer. The answer is the draft order that went up on Monday was before the governor made his announcements yesterday, which led to some changes in the draft orders, such as I will not be able to allow swimming pools to open, unfortunately. That was explicitly not allowed by the governor. So there are some changes to that draft order that went up on Monday that have been made because of what the governor announced yesterday. And then today, as soon as the governor announces that he's going to allow all of California to go into phase 2, then I will be releasing my new sheltering in place order. I still have another meeting with county council today to just put some fine tuning on it because we're waiting for the governor's announcement. But we believe that he's going to allow us to go into phase 2. And therefore my order will be released later this evening and go into effect at midnight tonight. And it does have some changes from the Monday draft because of the governor. Regarding the limited reopening, which has been divided into an early phase 2 and a late phase 2, and the division between early and late as this attestation process, yes, as of this moment, we will not be able to enter later phase 2 until we get more testing capacity in our county to allow us to do 135 tests a day. So at this moment, we can't do that because we don't have the PCR processing capacity to process 135 tests a day, but we're working very hard on that. And I actually feel confident that by June 1st, we will have what we need to complete that attestation process and be able to further reopen into the further part of stage 2. And an example is that early phase 2 allows retail opening with curbside pickup, and later phase 2, you can actually shop within the store. I would like to see all of our retail open up with shopping inside the store. I think it's only fair, and I think Mendocino County, we're ready for that because we're doing a good job of social distancing, wearing facial coverings, staying home when we're sick. But the governor's rulings do not allow us to do that at this time because we don't have the testing capacity at this time. But we're fighting hard to get it, so I believe we will.
All right, thank you.
Thank you very much, Mike. I'm going to go over to Carmel to close us out for our Friday update.
Oh, thank you, Sarah. And Dr. Doohan, especially thank you for your time today and for all of the information that you shared. Again, we will be here next Friday, and certainly during the week as things progress, we will put out press releases, and if we need to schedule another press conference, we will. So thank you everyone for your time. Stay safe.